Are you having irregular spotting and you just don't know what to do? I will help you understand what to do and when to go to your gynecologist. I am Jeff McQueary, a Tennessee gynecologist. I'm here if your gynecologic problems are dominating your life and you want to take back control. Solve your problems with solutions from my channel, Women's Healthcare Answers. Spotting between your periods is extremely common and happens to most women at some point in their menstrual life. I want to emphasize most of the time it's nothing to worry about and never typically a major health problem, but it's good to be cautious. Stay till the end to make sure you know how to prevent spotting from even happening. You need to know this information. Doctors call bleeding in between your periods breakthrough bleeding. This because it's not a real period. There is some slight abnormality in the uterine lining because of the addition of hormones or inflammation. And I know you suspected that. That is why you're worried about it not being quite normal in the first place. Many things can cause spotting in between periods. If you've recently been placed on birth control, you very well might spot during the first 3 months of starting it. The different types of birth control that can cause spotting may include pills, the patch, the Depo-Provera shot, the ring, or even the implant that goes in your arm. But with starting any birth control, it is very important to time the start of that correctly. Irregular bleeding and spotting can be caused if you were irregular in the first place prior to starting the birth control pill. Your doctor will know how to time that correctly. But even if you've been on birth control for a long period of time, you can have irregular spotting, possibly because the uterine lining has just become a little thickened. Also, progesterone-only birth control pills, such as Depo-Provera shot, the progesterone-only birth control pill called the mini pill, and the arm implant and a progesterone-only IUD are very well known for causing irregular bleeding, and I will talk more about that later. But also inconsistency in taking your birth control at the same time every day can lead to irregularity. Also, smoking can cause changes in the menstrual cycle that can lead to frequent or irregular cycles. And you always have to think about sexually transmitted diseases like chlamydia or gonorrhea that can cause spotting and should be diagnosed. Sometimes even if you have an IUD, it can cause infections of the uterine lining, leading to some irregularity. But the big one's stress. Stress that can be even brain hormonal issues that can lead to issues with your periods. But as you get older, you may even become perimenopausal, and this is kind of poor ovulation. This may lead to also low estrogen levels that cause uterine lining abnormalities or vaginal dryness. But those things aren't that serious, but more serious issues can also cause spotting. And these are the things that you definitely need to see your doctor about. So early pregnancy with spotting, and you may not even know you're pregnant yet. Also injury to the vagina or cervix. If you've had a recent miscarriage or an abortion with bleeding, it can be serious and you need to see your doctor. But you may even have a blood clotting disorder or fibroids. And a less concerning problem is polyps of the cervix and uterus, but they can cause irregular bleeding as well. And the worst thing, obviously, is cancers. And these cancers can be of the cervix, uterus, or even the vagina. Let me tell you a story of a 25-year-old patient who presented to me at my office years ago. She had irregular bleeding and she was on Depo-Provera, the shot. This contraceptive shot is progesterone only and it thins the uterine lining and very commonly causes no periods, but also can lead to some irregular bleeding as well. Well, I saw her first and gave her some extra estrogen to stabilize the uterine lining. I had done her exam and everything looked normal and I had no concerns at that point. 2 months later, when I saw her again, she was still bleeding. So I examined her again, and this time something was very different. She had a large 10-centimeter cancerous tumor that was literally being pushed out, aborted through her cervix. Just touching it caused hemorrhage, and I had to take her straight to the operating room. I don't tell you that story to scare you, but it's the reality of what doctors do. Most everything is pretty routine, just like spotting, until one day it's not. And the same can go for you. So you need to see your doctor. But as I mentioned, sometimes the spotting continues to get worse. You should call your doctor, and now you know why. You should try to figure out what's going on. So what are the types of symptoms that would be a clue that spotting may be more serious? Well, certainly if you have significant pain in your lower abdomen, you have a fever, you have significant discharge or odor, or if you're close to menopause, and that would be in the range of 45 to 55, you could have irregularity. Or honestly, if the bleeding continues to be a problem and you're just getting worried, go to your doctor. What are the common tests that your doctor would do if you had spotting? Well, physical exam. So typically we want to look at your cervix and vaginal area to make sure that there's not something there causing the bleeding. I would do a culture of the cervix for gonorrhea and chlamydia, also a pregnancy test, and typically an ultrasound. But even blood tests can be done to look for anemia or blood disorders that can lead to bleeding, and may be necessary, but typically are not. So if you like this video so far, hit the like button. It really helps with YouTube. And please subscribe, because if you miss any of my new medical videos coming out every week, who am I going to talk to? Just give me a thumbs up and please comment. So back to the information you want. So as I mentioned above, a very common type of birth control that causes and can continue to cause irregular bleeding is progesterone-only contraceptives. If you're taking a progesterone-only pill, it is extremely important to take that very regularly at the same time every day. Not only can missing pills cause irregularity, but it can lead you to getting pregnant if you're not consistently taking the pill. So the biggest benefit to progesterone-only contraception, though, is that you may not have any periods at all due to thinning of the uterine lining. So an occasional spotting episode may not be such a big deal, but it probably needs to be assessed to make sure. So are there certain drugs that can interfere with birth control and cause spotting? Well, there actually are, but it is not as common as you think. A big one is rifampin. This is an antibiotic commonly used to treat tuberculosis and leprosy. I know leprosy is not common in the US, but it is more common in other countries like India and Brazil and around the equator. It is more relevant to them, but rifampin can interfere with birth control by decreasing hormonal levels. So no other antibiotic, and this is what I want you to know, has that effect in decreasing hormone levels. So if you have to take antibiotics for bronchitis or strep throat or something like that, don't worry. It's not going to cause a problem with your birth control. But some drugs used to treat seizures can interfere with contraception and cause irregular bleeding, indicating that your contraceptive may not be working right. Talk to your doctor if you're on a seizure medication. You may need different contraception, and possibly even a few drugs that treat HIV can interfere with contraceptives as well. So even though spotting isn't harmful to you, it is very annoying. I wouldn't like it either. So what would I recommend you to do to prevent spotting from ever happening? So if you're taking birth control, take it very regularly. I know I've said that several times, but take it regularly at the same time each day. Also, it is not uncommon for some women to take birth control pills continuously for months at a time. So taking a break here and there, maybe every 3 months, can help with irregular spotting. Also, if you're on one of the ultra low dose birth control pills, you may need a slightly higher dose pill, and your doctor can help you with that. But if you're having spotting, with any contraceptive, including IUD or implant, your doctor can actually add a little oral estrogen, so a little extra estrogen for 14 days, and that could stabilize the uterine lining to diminish the amount of irregular spotting that you're having, but also quit smoking. You can do it. It does make a difference. So my main point is don't be worried. But if your spotting continues and it's more severe and it's associated with all those things above that are concerning factors, see your gynecologist. They are experts in trying to diagnose these problems and relieve your worry. So hopefully you feel you learned something, and as always, I've enjoyed being here with you. I would love to help you solve your problems at Women's Healthcare Answers. Remember, this video is meant for information purposes only. Please consult your own healthcare provider, but it's okay to reference the information I give you.